Hello, my name is Giangregorio. I am a clinical coordinator here at Boston Children's Hospital in the Heart Center program. As a former graduate of the Nursing Science Fellowship, I'm delighted to introduce to you my Nursing Science Fellowship mentors, Dr. Jean Connor and Dr. Sandra Mott. Dr. Connor is the Director of Nursing Research for Cardiovascular and Critical Care Patient Services at Boston Children's Hospital. Dr. Connor received her PhD in 2003 from Columbia University School of Nursing in New York and completed her postdoctoral training through the Harvard-wide Pediatric Health Services Research Fellowship Program in Boston, Mass. Her program of research focuses on the development and implementation of nursing quality measurement and the work of nursing as it relates to patient outcomes. Dr. Mott is a nurse scientist in cardiovascular and critical care patient services at Boston Children's Hospital. Dr. Mott received her PhD in 2002 from University of Rhode Island School of Nursing. Her career spans over 40 years in the academic role, with the last 34 years championing nursing care of children and families in the School of Nursing at Boston College in Chestnut Hill, Massachusetts. Her program of research focuses on the parental perception of caring for the complex, chronically ill child following cardiovascular surgery over time. Following retirement from Boston College, Dr. Mott was not ready to retire from the profession and returned to Boston Children's Hospital to offer her skills in qualitative research for the advancement of pediatric nursing research. In 2011, following retirement from Boston College, Dr. Mott joined Dr. Connor in constructing a formal nursing science fellowship to support nurses in a program of nursing science inquiry. Welcome, Jean and Sandy, to this Open Pediatrics Forum. It's really a pleasure to be here and participating in this program with you.
Thank you.
Would you be able to take a few moments to explain to myself and the viewers a little bit about how the fellowship was conceptualized?
Yes. So we set out with a strong purpose. The suggestion when we started really talking about this idea was, in a very formal way, develop a purpose, an outcome, objectives, to really allow all to see as clearly as possible what we were going to be doing. I think that when we thought about these things early on, we had a sense that this was, that right step. And I think since its inception in 2009, it has continued to prove itself that those early thoughts were really, right in what we were trying to do.
And I have to agree with you. I think it was clearly an innovative and kind of life-changing idea for me, being a participant of the fellowship, and really seeing that connection between clinical inquiry and clinical practice is really something that's changed how I approach my everyday work as a bedside nurse and as a leader. So I clearly have been very, seen the benefit of these great ideas that have now become more formal.
Well, Jean and I were both committed to the concept that the truth of the universe, is, to quote Jean, is at the bedside. And it's the nurses who are providing the direct care in all dimensions that have the questions. And what they don't have is the formal knowledge of how to answer those questions. So we decided that if we surround them with that, and a huge part of the program is that one-to-one mentorship that is provided, and give them the rigor and walk them through the process, that it would all be good, that the outcomes would be positive, that they could be generalized, they would be disseminated, and that there was nothing that says that bedside nurses cannot do research, as long as they're working with a team that has the science background.
Yes, I absolutely agree. I think the benefit and what we learned from a clinical inquiry standpoint was clearly amazing and really changed how we think about practicing at the bedside as nurses. But the mentorship, as Jean mentioned, was really something. I don't know if that was part of how you thought about the program in the beginning, but clearly one of the things that many fellows continue to talk about is the professional development and the advantages of having that one-on-one mentorship, not only from clinical inquiry, but our kind of professional growth as nurses, which has really been a huge benefit and something that lots of fellows continue to talk about.
I think what was important in that early thinking is that we wanted the fellowship to be very practical, a very practical experience, in that, yes, there were didactic components, as Sandy mentioned, that all of the fellows experienced, but at the same time, we wanted the fellows to experience that true mentorship, as well as going through each phase and answering their question, whether it be a research question, an improvement science question, an evidence-based process, that experience should be just as practical as the mentorship. And that to understand on how that mentorship continues. So although we proposed the fellowship to be a 2-year experience, as anyone knows who's truly been mentored, your mentors are for life. And to how to develop that relationship and how to grow that community by being mentored and then continuing to mentor others that, come under you. And so I think that was a very important part of that structured experience, that there would be dedicated mentorship and that they would experience that at a very high level.
This is a good time to stop and ask our viewers to participate in the discussion. Please state your name, country, and city, and then please tell us about mentors in your hospital and how they are utilized. And now we're back with Jean and Sandy. You mentioned a little bit about the didactic portion and the structure of the program. So would you be able to elaborate a little bit about the actual structure of the program and how we use didactic portion as well as, clinical inquiry portions?
Well, as I designed the curriculum, it was like, how do you give this content to people who aren't in a formal educational program? Mm-hmm. And so we came up with the idea of having these quarterly forums where we would introduce the concepts and give really a bird's eye view of what was involved in quality improvement science, what was components, what was involved in original research, and the different forms that original research takes, and also with evidence-based practice. So we wanted to introduce all of this terminology and these concepts to the nurses. So we figured we would do that in a sort of sequential way through the quarterly forums. No way would they be able to be experts in all of this. It was more familiarizing them with the language and the concepts. Really and clearly, once they identified their question, they would become very knowledgeable of one of these methods through the mentorship. And so it was more one-on-one that they would gain that specific knowledge.
And I think that was a wonderful moment of the fellowship, was being exposed to all the different ways of researching a question and really choosing the right methodology for your question. And as someone who recently finished their Master's in Science of Nursing program, I have to say that one of the real benefits of the fellowship was it's impossible to kind of do every type of research on your own in one semester of graduate school, but through the fellowship, you would really experience all the fellows, the way they ask questions, the methodology they were going to use, and so you could kind of vicariously learn through their experiences and still really feel like you were exposed to a lot of different styles, qualitative, quantitative, and the different types of, research methods that we use. So I have to say it was really, the didactic portion was really, in my opinion, beyond what I was able to get in graduate school. Mm-hmm. This is a good time to stop and ask our viewers to participate in the discussion. Please state your name, country, and city, and then please tell us if you have an experience like this in your hospital. If you do have a program like this in your hospital, please describe with the rest of us. And now let's return to our guests, Jean and Sandy. In terms of the structure of the program, is there anything beyond the didactic portion that you think would be important to share with the viewers?
I think much of the fellowship was formed not only in conversation with Sandy, but just my own postdoctoral experience. And something that was a very important part of that experience was something that was called works in progress. And the works in progress was this idea of having fellows, as they were developing their project or whatever phase they were in their project, present those ideas to the forum, to the fellowship. And so I think something that has become a favorite of the fellows is the works in progress, because it really allows this community of ideas to come together and really develop skills in dissemination. So how does one present themselves? How does one present their ideas? But at the same time have a very interactive, committed thought about that individual's area of interest and how to help improve it, how to help see things that maybe the fellow couldn't see. So in addition to our nursing scientist faculty, who we should mention, although it really began the idea with Sandy and I as being the core mentors, it has continued to grow in our neuroscientist faculty support with Dr. Michelle DeGrazia, Dr. Meg McCabe, and Dr. Deborah LaJoy. But in addition to all of the neuroscientists who are her faculty, we invite other neuroscientists that work at the hospital, as well as our nursing administrative leaders, and who are just so committed and so impactful in the thinking of projects as they're happening. So it and the clinical experts. So it really is a great forum that not only the fellows are benefiting, but just that collective thought of how do we move our science and practice together. So I think that we have consistently thought the works in progress are important at each of the quarterly forums.
We recently did an evaluation of the fellowship with the current active fellows. And the one thing that they mentioned the most was the works in progress. They found that to be so stimulating and so helpful. And sometimes in our works in progress, when things haven't gone well for a particular project, we have them present that, because that also is a very valuable learning experience.
The lived experience of clinical inquiry, right?
And they have appreciated that, because it prepares them for the fact that, clinical inquiry isn't always a smooth highway. There are lots of bumps, and that's to be expected, and that's normal, and we grow from it. So that the works in progress is very important in the learning experience. The other thing we've started doing is inviting some of the graduate fellows to come back and share their works in progress. Some of it is what they did during the fellowship. Some of it is what they are currently doing beyond the fellowship, so that it isn't a program that ends in 2 years. It's a program that is just beginning after 2 years.
Absolutely, I agree. Once a fellow, always a fellow. And I have to say the works in progress was really an essential element of learning and professional development. When I first started as a fellow in 2012 with Anna Fisk and Dennis Doherty, who we'll hear from later in the program, I remember Dennis vividly thinking or rethinking if he had made a good choice to be in the fellowship when we were presented with what we needed to have ready for the works in progress. And we were all very nervous to present what we were doing with other leaders in the hospital, including Dr. Patty Hickey and Dr. Martha Curley. So it really was a really important part of, as you said, Sandy, even when things are not always going well, how do you share that with your community of researchers and have feedback, and even just to present work in front of people is a really important moment as well.
And, and I would say that with each group, and maybe just to explain how does the fellowship work, and us starting in 2009, it actually started just with one person, one experience. But at each group of fellows that we have brought through, and since that original experience in 2009, we had our next group, which, as you mentioned, was you and Dennis and Anna. We've learned with each group, and I think that has been important for Sandy and I, who were always evaluating the process. Were we, really capturing the opportunity as best possible? Were there things that we needed to think through? But what was exciting to us is that each of the fellows were unique. And I think if we're going to be hearing from Dennis and Anna and other fellows, that will probably come out, that there was something that was different for each of the fellows. And I think that was important, that although we provided this structured experience, that it was a unique experience for each person, and how it developed their knowledge around inquiry, and advancing their own practice, but also their professional development was something very exciting for Sandy and I to see, and that it was replicated in each fellow that came through the program, that there was something that happened that was extremely positive and has really continued to inform their thinking.
Absolutely. This is a good time to stop and ask our viewers to participate in the discussion. Please state your name, country, and city, and then tell us how you are advancing the science of nursing in your hospital. Now we return to Jean and Sandy. You're mentioning other fellows, so I think it would really be a great time to talk about the overall growth of the program and the different types of fellows that we've had in the program. And I know that it's kind of actually gone beyond Boston Children's Hospital.
Yes, it has.
Yeah. So again, I think we had that one fellow, Christine LaGrasta, who I think maybe we'll also hear from in the viewing, right? And then we're still very focused in our experience in the cardiovascular and critical care areas. And so that was the reflection of what the next group was that I think we formally started in 2012. So Christine was in 2009, but then 2012. And really the fellowship started to grow through the fellows. It was actually that word of mouth. And so people started hearing about it across our hospital. And were interested, wanting to know, well, what is it the fellowship that's going on? And really saw, although we started in a concentrated area of pediatric care, it was a very generalizable idea, so that all our nursing specialties thought that there was a benefit to this experience. And so really with the leadership of Dr. Patty Hickey and the other nurse executives, really allowing an opportunity across the organization, that we had nurses from our emergency department, and it still was very much so focused as a bedside clinical role opportunity. But then again, this idea of a structured mentorship inquiry, understanding that all nursing roles are evidence-based roles and that they practice in that evidence-based way. So we then had nurses from our administrative areas, from our clinical nurse specialists, right. And so I think once that happened, it really became seen as a hospital organization-wide opportunity, which really enhanced the fellowship in a way that it really truly was a community at that point of nurses from across coming together and again, finding more similarity than differences in their practice that I think was very powerful, not only for the fellows, but for us to see.
And it's extended to the satellites.
And the leaders. You mentioned that we've gone beyond our borders. and I do think that also has been an exciting opportunity. We've had fellows from other hospitals across the country, but then also internationally. And again, I think that's just enriched the conversation and the community of pediatric nurses committed to inquiry. So I think to date we've enrolled 51 fellows.
Yes.
And we have a number, I think, important outcomes. So this whole idea of evaluation.
Practices can change.
Just like any nurse scientist, right? You're always evaluating. And so we really started to think about what were the outcomes that we were seeing. And we were seeing inconsistency in outcomes that I think was also important to the whole fellowship structure, and that the commitment to dissemination, the projects that were being completed were very well received at national meetings, international meetings, in the form of manuscripts. And as part of this fellowship experience, we wanted to give them that full experience of a researcher. So not only developing the proposal, but seeking funding. And so it is almost a standard part. I would say it probably is a standard part that all of our fellows have submitted their project for funding consideration, and have been very successful. And I think that has been a very empowering and productive experience. We talked a little bit about the professional development, and again, not a requirement, but we have seen many of our fellows, sometimes during the fellowship itself, seek further academic preparation. You had mentioned
like you
your
did,
own, right? And so again, not a requirement, but I think once the fellows saw the value, if you will, and really understanding inquiry and how powerful it could be to your practice, whatever your role was, they could then understand that further academic preparation in a way that they couldn't before, almost.
They often said that now they had the beginning of their tool chest and they needed to add to it. They realized that although they had declared that they were never going back to school, that now they were actually excited to go back to school because they knew what they needed to learn, and they knew what opportunities laid ahead for them. And so they went on and got their degrees, or are currently in their programs. I think they are I think one of the, Anna will mention that she started out as a associate degree and is now a doctoral candidate.
Right.
So, and that was all because of the experiences that she had in the fellowship, and realizing that, yes, I have questions and I can answer them, and I am learning how to answer even more of them. So that has been contagious, and many of the fellows are, coming back and talking about, okay, I know I want to go back to school. What are my options? How do I manage this? What's a good time? And so forth. So they also say that they have changed their way of thinking. They now think differently. They think about their care differently. They think about the possibilities and ways to improve care and advance the science. And that's really, as I think you mentioned at the beginning, a life-changing experience.
And I do absolutely agree. I know we've had other conversations about this, but I think the way that you start thinking and just kind of questioning and knowing that there could be other ways to approach any problem, using evidence to kind of drive your decisions and to drive your actions really resonates throughout the whole program. And it is something where I think once you've been exposed to that kind of thinking, you really can't go back. We've kind of talked about the toddler who starts to walk doesn't go back to crawling. You just kind of keep moving forward with your development. And I think that, the fellowship has been really, a wonderful catalyst for a lot of great thinkers and formalizing their education and advancing their careers as well, which I don't know if that was an intended outcome, but it certainly has been a very big part of it.
And I think we've seen it with each of our fellows.
Exactly.
I think the impact, so when you talk about the impact, it's the individual impact, but just as exciting to see that in each of our fellows is to truly see an impact in our care at all different ways. And so we've now reached a point where we have able to disseminate our outcomes in a true impact on practice. And so how practice has changed because of that fellow's question, because of that fellow's challenging the given, saying, okay, I know this is how we've always done it, but is there a better way? Is there a better way that the patient and family can experience that optimal outcome? And I think that has been very rewarding, not only to the fellows, but how we think about our science, that, you know, how we're truly advancing that mission and vision. And I think that's been very important to our story.
Absolutely. I really agree with that. It's really been something that and again, going back to when you were talking about the fellowship expanding across the hospital, part of the benefit of being involved in an experience that really involves everyone from the hospital, and even when I was in the fellowship, there was a nurse from Florida who was enrolled. It really just gives you this broader network of professionals that you can share your idea with, talk through problems, and even on a practical level, knowing people throughout the hospital, and even knowing I have a friend in Florida, if I wanted to ask her how they're, you know, looking at a certain problem, you know, you have all these other colleagues that you can reach out to. And I think that that's part of the professional development, and broadening your network of nursing professionals has also been really an unintended outcome of the program, which has really probably been one of the most impactful as well.
And I think we're at a point where the fellowship, in many ways, because of the graduates, continues to give back. And so that's, you know, been an exciting part of this whole idea of how we continue to grow our profession. The fellows know right from day one how much I admire Florence Nightingale and her really, you know, just she's has put forward so many important ideas, but this whole idea that every day we have an opportunity to advance our science. And so tradition is part of the fellowship. And so, as Sandy mentioned, inquiry can be quite challenging. And that whole idea of what do we need to focus on in those moments. So each of our fellows receives a plaque with the, one of what I find Florence's most impactful statements about progress, and that we have an opportunity in our nursing every year, every month, every week. I think I updated it to every day. Take my word for it, we're going back. And I think that's the kind of message that we want our nurses to know, that it really is up to us as professionals, that there's an accountability to that. And experiencing the fellowship empowers them to really meet that charge.
I agree. Let's stop here and listen to what some of our former fellows have to say about their experience in the program.
The most meaningful thing for me, I think, was the ability to take the time to think about a complex problem and work it through using research methodology. As a nursing director, I usually run from thing to thing trying to solve problems. And the fellowship gave me the opportunity to take a minute, pause, think about the question, and think about how I might solve it in a different way than I do in my everyday job. I think it's taught me a lot of skills that I maybe needed to refine. I was able to effectively use research methodology to solve a complex problem that was important to me and my clinical area. I think it's also helped me be a role model for staff that I work with in my programs, because as a director, I was there with people who were finishing the fellowship, and then as I left, people were starting the fellowship.
I think the most meaningful part of the fellowship was the mentoring that I received and the role models that I was able to follow. When I started the fellowship, I didn't realize I needed a mentor. I didn't realize the power that a mentor could provide. Research is not done in a vacuum. It's not done in a silo. You have to have a whole team of experts to help you with your one research question, whether it has 5 aims or just one simple aim. So I think one of the biggest things that I've really learned and I've been able to take away from the fellowship is that teamwork. So when I started the fellowship, I was getting my master's as a nurse practitioner. And then I've been working as a nurse practitioner for the past 5 years. And then this past year, I started in the doctoral nursing practice program at Northeastern too. So that's, the fellowship has opened windows, opened doors, so to speak, to do more, to answer my questions, help me answer my research questions, or help answer any kind of practice questions. You know, we always say we challenge the givens, and you know, and Florence Nightingale has always said that, you know, we're never finished nurses. We should always be asking, and I feel because of the mentorship that I've had and because of the strong role models, I know now that I should be asking those questions. I have the confidence to ask them, and I also know that I can go outside my program and start using the connections that I've made to help me answer my questions.
So one of the best things about the fellowship is the resources you have. You quickly learn that it does take a village. Patty kind of sparked my interest and let me believe that I could move further despite the fact that I had not been in school for over 25 years. And then you meet the team of the research fellowship and you find out that Jean Connor can tell you anything you want to know about quantitative research and get really excited when numbers came, which at the beginning, because I hadn't returned to school, I really didn't know what they meant, but I believed her when she said they were good. And then Sandy has so much history. She has history in the hospital. And one of my projects was a qualitative project that is totally something that she excels in. And she was really able to hear what I was hearing from my parents that I interviewed and really understand it, really help me be able to take the data I found that isn't quantitative, it isn't a number, it's people's opinions and what they say and what they think and what they feel and what I got out of their conversations, and really turn that into research. The funny thing is that's exactly what nurses do every day. We hear what parents say all day, and we sort of factor that all in and put it in our sort of mind bank of things to know. And she's able to take those thoughts and be able to show you that it's research. You've learned something that we didn't know about parents and be able to produce it and share it with others. And then we met others like Michelle DeGrazia, who does a lot of products. And if you'd say, well, I'd really love to make something that would help this work better, now you know the expert to go to look at that. And it really helps you go outside of your sort of comfort zone. For me, doing ICU, where a lot of our nurse researchers and nurse scientists hadn't done, I sort of had a little bit I could share too. And you learn that. You learn that everybody has an expertise and a viewpoint that's valid, that's going to help you further research and further the care of children, which is why we're all here.
The most meaningful thing in the Nursing Science Fellowship was the support and empowerment that I got from my mentors. I always kind of, if I was thinking about it before the Science Fellowship, I had a lot of ideas about ways that I wanted to help nursing colleagues, how I wanted to improve the work experience of my colleagues that I work with. They took a vested interest in me and had it was an empowering way. I never left a meeting with the nurse scientist and not, sort of been proud about the work I was doing or the ideas that I had, even if I went into it feeling like, oh, I'm not doing a good job at this. So one of the most important things is the support and the empowerment that it brought.
So I think that's really impressive what those 4 fellows had just spoken about to the fellowship. How does that make you feel? Do you sense that kind of impact that you have on these fellows as they work through the program?
I think we have the pleasure of so many interactions and conversations with the fellows. And I think to hear it in this context, actually it is extremely powerful.
Warmly satisfying.
And very validating that there is a very important way to think about our profession and the growth of not only the practice and advancing the science, but also the individual. Yes. And I think all of those things together have the opportunity for that best patient outcome and family experience. Yes. So I think for us to hear this, it really is quite rewarding, and knowing that we are having a part, right, in that overall experience.
Yes, and we often, sort of reflect on the various fellows and their experiences. Mm-hmm. As they go through the program, we comment on their growth and their aha moments when all of a sudden something came together for them, and the excitement that engenders.
Right.
So that, that's our perspective of them. But now to hear it from them
Yes.
is very gratifying, because as we mentioned earlier, this is one of our most important aspects of our job. We really feel that providing this to the staff nurses and nurses of all levels, all roles throughout the hospital is so very important. And it will advance the science of nursing, especially the science of pediatric nursing, which is our goal.
Wonderful. Let's go now to Dr. Patricia Hickey, who has provided some thoughts on the fellowship. Dr. Hickey is the Vice President and Associate Chief Nurse at Boston Children's Hospital and a co-founder of the fellowship program.
To date, we've had almost 60 nurses enrolled in the fellowship and 39 graduates. So across the Department of Nursing and Patient Care Services, we have graduates of the Nursing Science Fellowship continuing to examine important questions, participate in improvement science projects, and really help to advance nursing science and clinical inquiry across the whole Department of Nursing in every specialty. So as we move forward into the future, it will be important that we have staff nurses who are well equipped and knowledgeable in the nursing science process so that they can advance important questions, develop those questions, and participate in improvement science projects, all for the benefit of the patients and families that we care for, as well as important innovative ways to deliver care into the future.
And now we return with Jean and Sandy. Dr. Hickey is a great support for the fellowship. Can you tell us a little bit about her role in this program?
I think it was from that first conversation. She has been just extremely supportive. She is such a visionary for how we think about our practice. And when I started speaking to her about this original experience in 2009 with the one nurse, and I remember exactly saying to her that I think we can actually enhance this, grow this with Dr. Sandy Mott coming. And she was the first to say, yes, we need to do this. And she has continued to really support it at every level. She herself is a nurse scientist in that she has developed an amazing program of research. And she truly makes it a point to interact with the fellows in the fellowship forums. She herself has mentored some of the fellows in different portions of their project. And she advocates for this at the leadership level with our other nurse executives, and has really been a champion for having this funded through our hospital nursing chair, the Eileen Sporing Carpenter chair. So I think of all the amazing contributions we've had to our fellowship. She clearly has led the way and continues. And I think at the times of graduation, she is there to really celebrate the achievement of the fellows completing the 2-year program. So it really is quite wonderful to have her as an active support, but really a partner in this.
I agree. I really enjoyed the time she came and spoke when I was a fellow, sharing her own research. And she certainly is very motivational and inspirational in terms of continuing with more education. I think she has some motto similar to 1 degree every decade. So I have to think about what I'm doing next decade.
That's right. PhD.
Yeah, but she obviously is very supportive of this program and truly inspirational to all of us. Thank you so much. It's been wonderful sharing these stories and experiences that I personally was able to have, and I hope the viewers are able to really understand what a really innovative and impactful program this has been at Boston Children's Hospital nationally and now internationally. And congratulations to you and the other nursing scientists, nursing scientists who are leading this program. I just cannot tell you enough how much it has meant to me personally, but just knowing that so many people in our hospital are talking about it, it comes up as regular conversation piece and really something that's just making a huge difference here for nursing at Boston Children's Hospital.
No, it's our pleasure.
It's
I
our
think
pleasure.
it's one of our
It's our highlight of
it really is.
job description.
Yeah, the fellowship. So thank you.
Thank you.
Thank you.